So once again, we are having a complex case where we have tumor here on the cage part, and here we'll try to segment the bone and the tumor mass from the CT. So let's get started. We'll try to segment bone first. So I'll use the preset bone over here, but I can see it is not capturing well. So I'll little bit tweak its settings and land maybe till here if I feel it's okay. Let us check once again. It seems okay, but we'll see going a little bit up and down. But I feel this is the optimum one to capture bone related information. So we'll hit apply. And before going to calculate 3D and all, I'll use this island effect so that it will delete or it will eliminate all this distorted pixels from the segmentation. And then maybe once closing of the gaps so that the small gaps can be closed, and I'll have a better picture when I create 3D reconstruct, and maybe a little bit joint smoothing so that model will appear more channelized and more clear. So that is done, and then let us calculate this 3D here. So yeah, I have this nice bone information over here, and it has soft tissue captured as well for our reference. So that's an additional good thing. And I want only ribcage side of structure over here. So let us maximize and let us edit this a bit so that we can clear other areas. So I'll use this edit segment over here, and I'll use threshold. Not I'll keep off threshold, and I'll use lasso brush because it gives me more freedom to edit the areas. So I'll carefully from the joint, I'll try to remove these areas. So this is clear. Maybe I can clear this a little bit more. Yeah. Then on the other side, first of all, this is a big chunk, and then I can rotate and set a nice perspective view to clear other areas. And this joint as well. So I have a habit of removing this sort of connections from the segmentation, and then keep on using island effect, which gives me quick and better result if rather than doing everything manually. So in a way, the software helps to segment in a faster way. So now I can see that there are sufficient bone information available here. So for now, I'll keep it that, and then we'll focus on tumor segmentation now. So let's see how first tumor looks like. So it will give us the fair amount of idea. So from the sagittal view, we can see that this is the tentative shape of tumor, and it ranges from somewhere around here, and it goes till the other side like this. Okay, and on the axial side as well, from the top to bottom, let's glance from so till here it comes somewhere. So we'll add one more mask over here, and from the segmentation's threshold tool, we can modify this a bit, and we need to capture this area. So let us take this lower limit all the way to down till it covers the required area. Okay, this seems a proper addition, I feel, because it is capturing almost the part of the tumor. I won't mind these perforations as of now because we have automated tools here, semi-automated tools that can take care of those filling and on in the later. So my process is now I want to exclude the bone information. So this upper threshold limit, I'll take that selection to further down till it excludes all the bone related information from the CT scan. So I can see it is now not including any bone related information if I try to look on ribs or anything else. Right? So let us go further down if it uncovers more. So I guess, yeah, this is the better selection, I feel. And let's see, we'll turn off 3D for now because I have some other operations to do. And as I said earlier, I try to use a lot of island effect. It gives me a quick ROI and in more better way. So it is here, and then maybe the same way we have did earlier, we will use this closing operation. So it will have a nice covered segmentation here, and that gives us a fair amount of idea of the coverage of the tumor mass. So if we can see it is covering well over here, and maybe we can, from here, we can toggle the transparency a bit so that we have a better perspective view, and on the sagittal side as well. So it seems it is covered well. So now we can use some of the 3D edit tools that will help to segment our tumor properly. So now we will create 3D reconstruct of it. And since we have better idea of tumor trajectory now, so we will keep that in mind, and accordingly we will edit the 3D reconstruct with this 3D editing tools over here. So it is a big like this is created. So we can see tumor here approximately. So this area we'll try to preserve, and everything else we can remove through this erase tool like this. So first of all, this thing can be removed. Then we can move to the other view, and maybe from here we can remove this chunk and this one. Then from the top we can remove this, so that other stuff will be removed, and you can see that it is now covering all the tumor mass only, and it is precisely surrounding the ribs, indicating its concentration of the tumor mass over here. Okay, so we'll do a joint smoothing once again here so that I have a better view, and I can see that might be some of the part needs to be added over here, it feels. So this part maybe, so we have the option of multiple slice edit, where with simple slices you can add and subtract some of the data, but I'll have the add operation on here, and we'll carefully see where the tumor is expanding and tumor is growing. So from here that it is ends, and these are all the mass of the tumor, and then it ends over here along with this area. So this I'll add to my main mask. Let's see how it turns. Okay, if I feel it is proper, I can hit straight away apply, and I can see it is a little better coverage. I can see some of the better coverage here, but still there are some of the areas which needs to be verified. So I'll go to the other views as well, because from here it's just cuts off. So that is unlikely, because anatomy wise nothing goes off that abruptly. So it indicates that there is some addition required for a smooth transition and better coverage. So once again, I'll add this a little, and I'll hit apply, and then I'll have a better coverage like this. Yeah, and I'll see once if it is not covering the bone information with it. And again, once I'll use island effect once more, so any unknown pixels that might be there and which are not into our concentration might get removed. So I see that now we do not need just a simple edit over here, that I can use the contour editing option, and I can erase this portion like this. Maybe need to choose better mask, proper mask here. Yes. Again, this is also, I can switch to paint and I can modify like this. So okay, it seems okay now, and once I see this, what is this? So just an addition, so I can paint it and streamline it a bit and erase this pixel from here. Okay, so it feels okay now, because it covers the almost boundary of the tumor here, which is on the rib side of it. So let's see now how it interacts with the main bone structure like this. So we can toggle the transparency of it over here, and before assessing further, let's convert this into an object so that we can have a look at the mesh files too. So if we can see from over here, it is ranging from this rib to till it goes like till the bottom of it. So it's a very big tumor in front of us. So it can use for surgical planning, and now they can have a better understanding. And on top of it, if it required, they can design team can develop any implant or cutting guide, or maybe simply they can cut this model into half or reduce it, and can have a printable model that can be used for surgery planning and further surgery management and clinical care management. Thank you.